everyone. Welcome back to another episode, Your Body, Your Clues. I'm Dr. Hodan, family nurse practitioner and functional medicine clinician. I have...
Hi everyone, I'm Ahlaam. And today is our second episode.
Yes.
And we're covering H. pylori. So as we promised, we're going to have a whole dedicated episode to H. pylori, the bacteria, all things gut health, and how to feel better, hopefully, at the end of this. So my first question to you, Dr. Hodan, is what is H. pylori? What is the symptoms? What causes it?
H. pylori. I think that probably, if you talk to any East African, if you talk to any Somali, it is the number one infection people are complaining about gut health. And the reason why is the numbers back it up. So really half of the global population is infected with H. pylori. It is a bacteria that lives in your gut, and if over time, it starts to really wreak havoc in your guts for various different symptomology. And the problem with H. pylori, the reason why it's becoming so pronounced is the treatment that we've been using has become, like the bacteria has become resistant to the treatment, which means people's symptoms are consistently getting worse. The infection is not being cleared. The bacteria itself is getting very smart and really changing its DNA so that it can evade and hide from the antibiotics. The symptomology, what people feel, can range from general like bloating, acid reflux, bit of a gut, pain, discomfort, bloating, but it could get really extreme, right? This bacteria has the potential to just really like mess up inside your gut, right? Destroy the gut lining, reduce your stomach acids, which it's very vital for you to be able to process food, right? And take out nutrition that you need from the food that you're eating. And the big concern is that over time, it could cause ulcers and really can actually cause cancer, stomach cancer, duodenal cancer. So that is why H. pylori really has become quite an issue in our community in particular. It's becoming an issue across the world. It's an issue in general primary care that we are seeing. I work primarily in practices where there are more people of color, people who travel, immigrants, all that. So I do see a lot of H. pylori, and it is how it's being managed. It's not necessarily conducive to eradicating the bacteria, and also preventing from reinfection.
It's almost like a public health crisis, you were saying, which like half the population has it in the world. And I know a lot of immigrant communities, like they travel back home, and I know it's worse in like the global south, which is why a lot of East Africans have it.
Yeah. So absolutely, it's a public health epidemic. In fact, so this, I'm not saying this is causing what I'm about to say, but there may be a hypothesis there is a link. So one of the leading cancers in Somalia right now is esophageal cancer. And I'm not saying this is causing it, but I think it's not and again, we don't have a lot of data, we don't do a lot of research, so, the hypothesis is possible. I'm not saying it's causing it, but like I said, 50% is in the Western world. In the Eastern world, in Somalia, Africa, and other parts, you're talking about 70-80% infection rate. You're talking about health systems that are not set up to manage this kind of really intelligent, in a negative way, bacteria that has learned how to not respond to traditional treatments that we've been used to giving. Just recently, 2024. The American Academy of Gastroenterology has come up with a new protocol to treating it. Much of the world in developing worlds not necessarily having access to that. A lot of providers, a lot of clinicians, a lot of doctors, NPs, we're not up to date on that.
Yeah.
So people are still using the old treatments, right? That we've become a global world. Everybody's traveling, right? Everybody's mingling. Everybody's eating out. All the reasons why H. pylori is thriving.
Yeah.
Right?
And also, it's like people can get it, like, especially in our community, this small
Yeah.
community, we live like 5, 6, 8 people at our house, and like using the same toilets, same like
Eat
silverware.
from the same bowl sometimes.
Yeah, like,
right?
so all those give, a risk for us to get it from each other.
100%. So some of the ways that H. pylori gets traveled and why is it prominent in our culture, in our communities, is number one, we have large families. Alhamdulillah, it is, a blessing, but it could be a risk factor. We are very close-knit community. So we go to each other's houses and eat together. And I mean, that is what makes us who we are. Also, we eat out a lot. We have restaurant, again, hand hygiene and washing, and that's very, very important. The other way is contaminated water. This is one of the reasons why, most of us, when we're back home, sometimes we might be taking in water that's contaminated. And then you come back with the contaminated self and you're around. So the transmission is very, very easy. And our way of life is conducive to this bug becoming more prominent in our community. So, but I mean, again, though, like, awareness is important, right? Like, I think this is one of the reasons why we want to do this podcast is, like, we can't prevent everything, but we can, like, make sure we are knowledgeable of it and understanding, like, how these things, grow in our communities and what can we do, to help reduce the risk and maybe reduce the prevalence.
Yeah, like, I would definitely emphasize, like, this podcast is not like a fear-mongering podcast to
it
tell you
isn't.
all
It
the
isn't.
bacteria or like the epidemics happening, but kind of helping you understand like what your body's saying, the clues it's giving you. And it's so funny. So I had H. pylori, and I did not know until discussing this with you, but after the medication, that does not stop there. There's like a whole protocol that we should be following. And so I wanted to ask you what the proper like H. pylori protocol is from the day you get diagnosed until you're done with your medication, and what it should look like after.
So this is the thing with H. pylori, and I think this is why people are continuously not relieved of their symptoms. So from burning and acid reflux to just pain, intense pain, to bloating, to nausea and vomiting, loss of appetite. Some people have constipation, constant burping. People lose weight. People get depressed. As I shared, I think in the last episode, I've spoken to a Somali uncle who basically said, Hodan, this is really has impacted me to the point where, like, my life just means, like, has no meaning anymore.
Yeah, he's suicidal.
Suicidal, right? Like, alhamdulillah, with the Z-Man and everything, that's not the case. But when you talk to him, that is powerful. And how painful this, and that's why I think information is really important. Educating yourself about symptoms management, what are the different ways. So in my practice, so I do general practice, right? So I am your average, GP, NP, family doc kind of practice. But what I also do is what's called functional medicine, right? Like, so functional medicine is really around root cause, understanding of why Ahlaam is, has anxiety, bloating, constipation, whatever the case might be, right? And it's not about just, handing you a pill, but really understanding where that's coming from. So this is why I think some of our, our practice and how we've tailored it to understand the root has made us more successful in managing. And this is where the differences are. So in just general practice, if somebody, number one, if you come in and you have those symptoms, you should be tested. So what are we testing? So we're testing for, if the bacteria is active, if it's an active infection. Okay, sometimes you can have, a foreign pathogen, but it might not be causing a problem, like TB. So many of us test positive on our skin TB test, but we don't necessarily mean we have TB in our chest and are infectious, right? So H. pylori could be the same. So the best way to know you have an active infection is to get the urea breath test. So you go, your provider orders it, you go, you get it. It's, basically testing to see if the infection is active. The other best one is stool. Testing for the antigen, is it present? So that is the second one. So those two, really good. What is not good is blood testing for H. pylori, period. Because what it does is it just tests, the result will show you you've had an infection. It's just in your system. Is it active?
I can't tell.
Or not? The same as I said, TB. Once you've been exposed, you will always test positive. It doesn't mean you're sick, right? So that is the same thing. So blood test is a no.
Always ask for a breath test.
Breath test
stool
is
test.
gold standard. It's the number one. Stool test. So what we also do is, remember I said there's a high resistance to the treatment.
Yeah.
Upward to 50% failure in treatment. Yeah. Right?
And what does failure of treatment look like? So let's say I start my treatment. What does failure look like?
Meaning you don't clear the infection.
Okay.
And then when you get retested, you're still infected.
Okay.
Or maybe a couple months down the road, your symptoms are back.
Okay.
So in the past, we've had what's called triple therapy. So you get 2 antibiotics and a PPI. And you're supposed to be on it for 2 weeks. I hear 7 days, I hear 10 days. No, 2 weeks. So the triple therapy, which has been the standard prior, is now it's ineffective. People have become resistant. So remember what I said? H. pylori is very, very smart. It really knows how to survive in your guts. It shuts off your acid production. And then what it does is it actually starts eating away at your gut lining. So your gut lining starts to become porous. Like your gut lining is supposed to be nice seal, so your stomach content is not entering into your bloodstream and vice versa. Okay? Introducing you to other pathogens, allowing it to grow not just it, but others, right? So this is why H. pylori is just a really nasty bug to have, right? So gut inflammation, reduction of acids, stomach acids, which again, you're not gonna absorb your nutrients. Your gut is gonna slow down. You're not pooping. So now you got SIBO because everything is fermenting in there, right? So it is really like a cascade of problems. So the bacteria now, superbug, has now overpowered the traditional treatment antibiotics. So the triple therapy in most people does not work.
Okay.
So now there's a new protocol called quadruple therapy. There's different ways it's very technical, so I'm not going to get into it. But the whole point is for you to understand that the old treatment is not really going to work for you. So when you see your provider, the person who's treating you, ask for the updated protocols, right? So it has much more protective treatment for your gut because it got a bismuth and all of that, which helps coating. The other problem too is the reason why it fails is the treatments are really hard on the stomach.
So people are not consistent with it, right?
People are not consistent. They're stopping.
Yeah.
Right? Because first of all, the bacteria has already hurt your gut.
Yeah.
Your gut lining is really raw. A lot of nerves, gut-brain axis, right? So when your gut is hurting, your brain is firing off, right? So it's very intense. That's why people feel a lot of pain. Because the minute your gut is like this, is destroyed and all these things are happening, that gut-brain axis is continuously firing. That's why people feel sick.
Also, I think we've all been conditioned to think the moment you start taking medication for sickness, you should start getting relief. So when you start getting more sick, you're like, this is not working. I gotta stop.
Exactly, right? So what is happening is that because, again, your gut is so raw, it's like very painful. And now we're adding these 2 antibiotics and the PPIs, and it's really rough. So then people naturally are going to say, I can't continue with this. Yeah. But what they have done is now the bacteria becomes smarter. Because if you stop, and this is general antibiotics, if you are on an antibiotics for an infection, please finish it. Antibiotic resistance is the number 1 problem globally right now. H. pylori is an example. Okay? So what we do now differently, not only are we using Western modalities, but we're also combining Eastern modalities.
Okay.
Because remember what I said, like it's not just about the infection, it's what the bacteria has done to your lining, your gut, and all of that. And what is also done to your entire system. Your brain is like constantly in fight flight mode. So you're producing cortisol, you're inflamed, you're raw. If that is not taken care of, the antibiotics is not going to work. It's going to actually make you more ill. So what we do prior to actually starting the treatment is put you on a protocol that helps you calm your system and your gut and start, like, people are burning from the inside.
Yeah.
So if you're burning from the inside, now I'm adding, harsh, really hard antibiotics, I mean, you can guess what's going to happen. People are not going to be able to finish.
Yeah.
So we really stage it. So what we do is first start with a calming protocol. Once you do that 2 weeks and your system's starting to kind of, at least feel it's not being attacked, then we get you started on the antibiotic protocol. But we also add a herbal regimen of antimicrobials, right? Because the Western pharmacological therapies are not necessarily going to wipe out the bacteria. So we add these herbal, like berberine, like really powerful garlic and all that, right? To support the elimination.
Yeah. Like a triple,
like a double whammy.
Yeah.
Right? Like, so we're giving this because I still believe this bug needs that level of treatment, like Western pharmacological intervention. But we also have these other very powerful research-based herbal antibiotics, antimicrobials.
Okay.
So you do that for 14 days.
Yeah.
You got your PPI, you got your antibiotics, you got your bismuth, and then you also have this other. On top of that, you're still taking your calm protocol.
Yeah.
Now we're giving you the antimicrobials. We add a few other calming agents with that protocol, right? Yeah. You go for 14 days. By then, we've wiped out that gut. Then we get into the healing phase.
Can we get into that? So, like, most people, after they're done with antibiotics, they're like, okay, cool, I got rid of the bacteria. They go on with their day.
And that's a problem.
And so what can everyday people do to, like, get used to the second step of healing?
So remember what I said? We started with a calm.
Yeah.
Then we have a kill protocol that helps with the pharmacological intervention.
Yeah.
Then now we have a healing protocol
that
we put you on for 3 months.
Got it.
Right?
Yeah.
So DGL, licorice, zinc carnosine, like NAC, multivitamins, like a whole lot.
I think that's what I'm on right now. Yeah. That's what I'm on.
Yeah, that's exactly
the protocol this morning.
Right? So it really is about, like, we need to rebuild that lining.
Yes.
It's not good enough to kill the bacteria. Because if you're not finishing that lining and repatching and, like doing that nice coating, it's going to find its way. Because the other thing, too, is we still haven't treated who? The family.
Yeah.
Most likely, if one person is infected, other people have it.
Yeah.
And not everybody's symptomatic. It's the other thing, too, why really people need to understand, like, just treating you is not it.
Get everyone else tested.
Get everybody else tested. If somebody's positive, treat them.
Yes.
Because it's, like I said, not everybody is vulnerable to H. pylori in terms of symptoms. But those that are vulnerable really, really suffer.
So should, like, families, like, okay, I know this is something I've practiced in my family, but if somebody goes abroad, let's say Somalia, East Africa, whatever, they come back, they get tested just to make sure that they don't have it. But if people live in big families, every year, and H. pylori is a prevalent thing, in their checkup, should they ask for a follow-up to see if they have an active H. pylori?
Can I tell you? So that's kind of a tricky question, right? So yes, they should be tested. But you also need to present symptoms.
Okay.
So the way the system works is that, and this is another thing that we need to understand as a community, is the way the healthcare system works, the way insurance works is we document symptoms, presentations. If you're not saying I've traveled and, maybe not connecting your body, your clues, right? Like, in the end, I went, last year I went to, wherever, and then I came back and my stomach seems bloated, or I can't go to the bathroom, or I'm having more acid reflux. Likely because you're either reactivated an infection or you're actively infected. So sharing that, say, I'm concerned about H. pylori, can I be, and these are my symptoms, right? Because not every provider is in a position to recognize you have H. pylori. Because not all of us have, like people get, you do your training and all of that, but it's about exposure and which populations that you're managing, right? Some populations, like right now in where I'm at, I don't see a lot of ulcerative colitis because the people that I'm treating are not, that demographic, right? I may see a few here and there, but that is not the main. I'll see a lot of H. pylori, I'll see a lot of diabetes, I'll see a lot of, you know what I mean? Like, so the person that you're seeing may not always understand this may be a risk factor for you. So you need to ask and say, I've traveled and I've noticed this since I've come back. I'd like to be tested for H. pylori. Then insurance will cover it. Because a lot of times people in America, I should say, Canada is different because we don't have that issue. Yes, free healthcare. You have to justify why you're ordering tests. So yes, get tested, get the family tested, note your symptoms. Right? Most of us have these GI symptoms that we're complaining about, bloating, gastritis, whatever, GERD, your stomach hurts, that kind of stuff, constipation. Those are legit reasons why you get tested for H. pylori.
Yeah. Another thing I would say, just because these symptoms are common in your family or amongst your community does not mean it's normal. I think that's the biggest problem in our community. Like somebody starts saying they have heartburn, your aunt would be like, that's normal. We all have heartburn. It's like, no, we're all sick. We need to get checked out. I think that's the thing.
Well, that's the thing too, right? Like, so exactly. Especially these symptoms of gut health, we've normalized. I mean, I see people who are constipated for a week, and I'm like, that's not normal. Yeah. Right? Like, but we don't talk about that, right?
My grandma told me she's always constipated. And I think it's
right.
normal.
So honestly, like, and that's the thing where
not my grandma, by the way. My poor grandma's very healthy. Yes. She's a very beautiful lady and she's healthy. I don't want my grandma
get a lot of phone calls.
No. All my grandparents are very healthy and they're not backed up. Okay.
Right, like, but indigestion, right? Like, if you lie down, your food coming up. Like, there's stuff that we just thought are normal that is not normal, and long term may cause you problems. And I think that's why your body, your clues is really, we're trying to unpack these symptoms and what you can do to understand so that you can be proactive. Because medicine should be proactive, right? Preventative care. That's how I've been trained. But no, we no longer are preventing nothing. We are just chasing disease. Right? And you see that in the general population of North America.
Absolutely. Dilemma time. So this dilemma is around H. pylori. Someone says, hi, Dr. Hodan. Thank you so much for speaking up H. pylori. It has ruined my life. I have been on many rounds of antibiotics and it's not working. I'm not sure what to do. How can I advocate myself and where to find new medications for H. pylori?
So, like any time when you're going to go see your medical provider, right? So that is not a very uncommon presentation. That is a lot of people that I talk to, multiple treatments and all of that. And people are being given the same thing. So it's a very famous definition of saying doing the same thing over and over again and expecting a different outcome is what definition of insanity. And I don't understand why that is the case, but it is the case, right? So if you are, someone who's been experiencing H. pylori for years and you've tried multiple treatments, probably the same protocol, I think you're warranted to ask your medical provider, because again, remember what we said, long-term H. pylori exposure and failure to treat and all that stuff could lead to cancer. That's so it is a very important understanding that people need to have. And don't be shy showing up and standing up for yourself. Because often it's not a dig at my colleagues, but we're very busy, right? Like you're seeing, patients every 15 minutes in many practices, right? That's why I choose to not practice that way anymore, because you get burnt out and you're not doing the best you can possibly do for your patients. So when you show up, be prepared. That's the other thing too. I tell people, if you're in general practice and you're going to go see your medical provider, please take a note, write your symptoms down, and, present your case. Right.
Also, even highlighting hey, I noticed that I've done these same 2 antibiotics.
What you have done, exactly. Take note. We are in such an information overload. Medical practitioners are no exception. You have to understand that. Like, we are as underwater as everybody else is.
Yeah.
But we are responsible to managing your care, right? So it's not, 100% all the time. So you need to be 100% for you, right? Clinicians cannot be 100% all the time for every patient. I think if anybody's telling you that, they're not being realistic with you, right? But you can be 100% for yourself. Meaning, come prepared. If you've had multiple documents, right? Like, people need to start. I'm sure there are apps. Ahlaam can share that probably.
Yeah,
like apps where you can document your symptoms, your treatments. Should be a standard protocol for everybody now.
Yeah.
We are in an information age. You don't need to have whatever. Many of you have access to your medical files, right? Like, know what you are being given, and it is okay to say. Yeah, it's actually okay to challenge your medical providers where it needs to be, not in a disrespectful way, but in a way that is, helpful for you.
Another thing that I think when I was growing up, I used to judge my parents and stuff like that in our community is getting second opinion. If you feel like your doctor is not really doing a good job, get a second opinion and come in with that as well. There's nothing wrong with a second opinion.
100%. And you need to come with questions too, right? Like, it's okay to ask questions because many patients I find are really smart, but they're afraid of being judged in that clinical room, right? But there's no question that is stupid question. It's important to you, right? Like, and people are getting paid to care for you, whether you're in America, anywhere else, whatever. If you're in, Africa, Somalia, whatever, you're paying out of your pocket, so you should be able to, ask questions and get answers to your questions. And ultimately, I think if you're not responsible for you, I'm sorry, healthcare is a very personal accountability kind of a business, right? People think it's your medical provider. No, that is just a snapshot. That is like 15 minutes of your life. Right? In a given day.
Yeah.
That other, 23 hours and 45 minutes, that's you.
Yeah.
What are you doing in that time?
Yeah.
And how are you showing up for yourself? I'm always about patient advocacy, people being able to understand, like, your health is your responsibility. People have a responsibility to do the right things that you ask in or to manage the symptoms that you're presenting with, but they're not psychic, and sometimes they're just flat out burnt out and can't come up with everything that you are feeling unless you're presenting it.
Yeah. And for this patient and like patients who have like struggled with H. pylori for years, and obviously you said if it goes untreated, like you have a risk for cancer, how can they after they finish their rounds of antibiotics, some of the protocols we're talking about, are they able to find that in general practice, or is that something they have to go for functional medicine?
So, no, general practice does not provide that, unfortunately. Most insurances won't cover that either, right? So it's really, and I'm hoping in the next couple of years that will change. But as it stands right now, it's not. So in addition to, the calming protocol, the kill protocol, and the healing protocol, the supplements, I do additional testing, right? Because clearly, if your infection is not clearing, there is something substantive in your gut that is a lot. Not everybody has H. pylori that is recurrent, right?
Yeah.
There's a reason why you're vulnerable, and we need to figure out what that is, right? So I do what's called a GI map, and what it does is it really looks at your gut microbiome. It looks at the integrity of your gut lining. Do you have a leaky gut? Do you have dysbiosis? What other infections are growing? What are your microbiomes, the good bacteria, doing? Do you have them, right? Is your stomach moving? What are your stomach enzymes doing, right? Are you depleted? Are you in fight-flight mode? Is your, inflammatories markers, are they all up, right? So that test really gives me an indication. Also, are you resistant to some antibiotics, right? So
is it okay if your doctor switches midway through? Let's say like you 3 days in, you're like, I can't do this anymore. Like you're just like reacting very bad. I know you said you should finish your medication, but what if you have to change it?
So this is where the question is. Most antibiotics work the same. Switching from one to the other, because you're not addressing the root cause. The antibiotic is not necessarily the problem at that point. The problem is your gut lining is really raw and needs to be supported. Do you understand what I mean?
Yeah.
Like, so that the new treatment, the bismuth treatment, is really good because bismuth not only has antimicrobial properties, but it coats the gut.
Protect it.
So it protects it. It makes it less painful to comply
That's nice.
with the treatment, right? And then you're put on PPI. So there's different types of PPIs that came out now. The general ones, omeprazole, whatever, they are okay, but there are stronger ones that are now that don't reduce your stomach acid. So there's different pharmacological interventions that are much better than the old treatments. And the average person doesn't understand that. Many of our providers right now are still stuck on the old treatment, the triple therapy, which is almost become obsolete because, like I said, the resistance rates are so high. For someone like that, I would recommend them to find a functional medicine clinician, right? Because as a general practice MP, if I saw someone like that, my hands are like that, I'm going to repeat the same thing.
Yeah.
Right?
Sad.
That because that's what the system offers.
Yeah.
But because I do functional medicine, I'm able to go outside of that confine and figure out, first of all, what resistance antibiotic do you have? What other infections do you have? Do you have SIBO? Do you have other opportunistic bacterial infections? Are there holes in your stomach? Is your IgE like to the roof? Like, are your inflammatory markers? Is your gut moving? Do you have enough bile and things to help? So these are like really foundational to treat H. pylori. H. pylori is not about taking antibiotics and calling a day. It is not. If that is what you're doing, and one thing we haven't talked about is diet and lifestyle.
Yeah, that's my next question. So after all, you take all the medications, you do all the protocols. What should your new lifestyle be? And like to prevent like reinfection or just to prevent like your gut health from feeling that low.
So number one, reduce your eating outside. Because the more you eat out, the more you're exposing yourself to infection. It's just common sense, right? Like, because the food that you're eating, you don't know where it has been. Number two, you need to eat anti-inflammatory diet, right? Like, your diet needs to shift. Figure out, like, so that test that I talked about, I also do gluten sensitivity testing, right? Because a lot of people are developing that.
And the anti-inflammatory food is, I always say this, essentially you should be able to tell what's on your plate.
Yes.
It should, I eat very anti-inflammatory, like for breakfast, it's eggs, sweet potatoes, and fruit.
Yeah.
I know exactly where this all came from. Like, I know
And it's not packaged.
Yes.
It's not processed.
Yeah.
It grew on the ground. It is not, like made in some fancy whatever, right? Like, the more organic we can go back to, and I see organic, not just like organic, like, I mean like natural foods.
Yeah.
Right? You should be able to eat your meats. I'm not anti-meat. I promote meat because we need meat, right? Like, so if you have other reasons for not eating meat, that's fine. But there's a whole thing about scare about, eating meats and cholesterol, all those things. All that is, the meat is not the problem. The cholesterol is not the problem. It's the inflammation that's the problem.
Yeah.
So
it's also the processed foods. So the saturated fat is so high in packaged foods where like.
But that's it, right? So eating good fats, high fiber. Fiber now is becoming the number one therapeutics for gut. It is helping you increase your good bacteria, building your microbiome. It is helping you produce an enzyme called butyrate, which is really, really, it's so fantastic that it's now they're talking about like it may be preventative for cancer. Like, there's new research that's coming up that's suggesting butyrate is like really a super agent, right? So fiber, 25 to 35 grams of fiber. Slow it. Like, if you haven't been eating fiber, starting at 30 gram might not be a good idea because you might get constipated, you might get bloated, it might start slow.
Hydrate as well.
Hydrate as well. Move, people. Like, we need to exercise. Like, you can't be sitting and expecting to heal from these things. And I'm not talking about Olympic size kind of stuff, right? 10-15 minute walk a day.
Yeah, stretches.
Proven stretching. Go up, down, whatever. Do the vacuuming in the house. Go upstairs and down, right? Go say hello to your neighbors. Like, it's not like, yes, we should all go to the gym or maybe, have some exercise, whatever, go for a run. But if that's not your thing, you should be moving 20 minutes a day.
Yeah. Especially if you're recovering from H. pylori and like
Yeah.
you're weak, you lost a lot of weight,
Yeah.
a lot of muscle. I would say like take it easy, walks,
Absolutely.
light, low
Yeah.
impact workouts and everything like that.
100%. So making sure you're eating well, making sure that you are sleeping, stress reduction. One of the key drivers for H. pylori symptoms is stress. Because when you're stressed, everything in your body, remember we said gut-brain axis, right? The minute that happens, your body is in flight mode, fight. So it feels like you're running away from some monsters, whatever, the lions, the dangers that doesn't really exist. So your body is in heightened mode. When the stomach is in heightened mode, like your body doesn't prioritize your gut; it shuts it down, right? So stress is really good. You need to sleep 8 hours a day, right? Social media has really killed everybody in terms of sleep quality.
Yeah.
Right? Doom scrolling, all of that. Like, you need to sleep. Your brain needs to shut off so your stomach can work, right? Because the nighttime is when things get cleaned and processed. So if you're not sleeping, then none of that is happening. So
Should people eat right? Like, there's always a debate of like when the last time you should eat is, especially
if you have these issues, gut issues, in general, you should not be eating 2 hours to 3 hours before you go to sleep. Try to go on as empty stomach as possible. Have a high pillow, so you should be propped up.
Oh wow.
To help. It's just gravity, right?
Yeah.
And regular sleep time. There is so much benefit to not just for gut health, but brain health and all of that, immune system, right? And if your immune system is strong, what happens?
Fight off.
You can fight off. Like 80% of your immune comes from your gut. And if your gut is sick, more infections, right? You're tired all the time. You're missing work. You're missing school. Your quality of life goes down, right? Like, so all mental health issues.
Yeah. I think we said this earlier, but like it makes so much sense where there's a rise of mental health issues and a rise of gut health. Like everyone's depressed, everyone has anxiety, everyone's also bloated. There got to be some type of connection.
Well, 100%, right? Like, and I think interesting, science is following what the public is now saying. We've never put so much effort into people's gut health as we are now, right? There's a lot of social media talks about gut health. It's popping and all of that for a good reason. Because, like I said, many people are feeling like they just can't get it together, right? Because they have gut health issues.
I would also say from a food science perspective, though, do not fall for the traps of food. Like a lot of the food companies, like there's a lot of high fiber packaged foods. Just get black beans. Like make it as natural as possible. I'm seeing all these things like 30 grams of fiber and like bread and whatever. Just have natural stuff because it's like, psyllium husk is my favorite thing as well. Like it's very good. It's also good for reducing cholesterol if you have that. Do not get the liquid stuff. No.
Yeah.
We need it in fruits.
I'm all about like as like natural as you get.
Yeah.
Right? I mean, you can have fun here and there, whatever, that's not the problem. But if it's like 5 days out of the 7 days a week you're eating hit and miss, then I think generally your health is going to suffer. But if you have gut issues, that's going to be even more problematic.
Yeah.
Because diet is where it begins and it ends. And I know at some point we're going to do food sensitivities and all of that, but that really is a trigger. Food is a trigger for H. pylori and a lot of these gut health issues that we're talking about, right? A lot of these sensitivities, spicy food, hot food, cold food, like what?
I think also with your body, your clue, like if your body's signaling you every time you have milk, you feel disgusting every time you have, listen to it. Like that's how I like figured out I had a gluten sensitivity. Like my body's literally shutting down when I have gluten. I don't have gluten anymore. My life is great. And then like slowly, if you want to reintroduce foods and see if you like build a tolerance to it, I get it. But I get so, I'm always going out to eat with some girlfriends. They can't have dairy. They ate everything they're not supposed to eat. And now we have to go home early. Like,
because you're starting. But listen, so that's one thing. The other thing too is I see Ahlaam doing this. It's worked for her, but is it necessarily going to work for me? Right? So you need to take advice with caution.
yes.
Even if you're going to try something new, try it in a slow dose, like very minimal. Don't overdose, right? Like don't over whatever. See how you react. And if you're someone who has gut sensitivity, you got to document. You got to write how you feel about things, because there is no magic bullet that's going to fix you. It is really trial and error, right? So usually I'll put people on FODMAP diet and then start slowly and then you are going to document when you ate that, how did you feel, right? Did your symptoms come back? And slowly reintroducing food. So in the end, like, I know social media and there's a lot of influencers pushing this, pushing that. And can I just talk about something else that I think people really need to understand is supplements are supplements.
Yeah.
Supplement, meaning add on. What are we adding on to?
Yeah.
Good food.
Yeah.
Good nutrition.
If you're having McDonald's, Taco Bell all the time.
Yeah, and you are talking about I have H. pylori recurrent infection, of course you will, right? If you're having deep fried food all the time and you're talking about you got all these, acid reflux, of course you're having indigestion. You're
also like another
you
thing
have
is
constipation.
Yeah, social media is very obsessed. Like dating culture is huge in my generation. Like everyone talks about dating.
Yeah.
If you're not taking care of good of your body, like how do you expect anyone to take care of you? That's the thing that gets me. It's like you treat yourself so bad. You're always sick. You're fatigued, and you're not doing anything to make yourself feel better.
We look glamorous on the outside. Are you glamorous in the inside? Yeah. I think I'm always asking people like, hiding your flaws with makeup and all that's beautiful, but you need to be able to just look at yourself in the mirror and how do you feel when you do that from holistically, right? Because that is the test of measure of how your health is, right? I'm always, like looking at, can I tell you, not passing judgment to anybody, but clinicians, when people come into the room, we're doing, annual visits, appearance matters. Right, because how someone looks is an indication of what kind of test you're gonna do, and this is just practice based, right? So, and I don't mean appearance in the sense of like what you're wearing, right? Appearance in the sense of like obesity is one of those things, right? Like abdominal girth is another one, right? Smoking and alcohol, all those things have a huge impact on your gut health, your general health in particular.
Yeah. No, this is very insightful.
Yeah.
If someone's listening to this right now and they're like, yo, this is speaking to me, I really need help. Is how, like, can they come to Ahlaam clinics if they're looking for a functional, are you accepting patients and everything?
So it's been overwhelming. We've got a lot of folks really wanting to be seen. We're diligently working at accommodating people. You can go to haliclinics.com. That is Hali Clinics, so HALICLINICS.com. So it's Hali Clinics with an S at the end.com. There's a team ready to support you. Inshallah, we'll be able to, and the other thing that I'm trying to do is like educate people and actually bring other clinicians who do functional medicine so that we can actually expand our ability to help people.
Yeah, no, inshallah. This was fun. So this is the H. pylori episode. I hope everyone benefited. And we'll be back with more.
Yes, thank you, Ahlaam.
Yeah.